Good evening. Welcome to Module 3 for the ADHD course for professionals. Tonight's presentation is going to be around micronutrients, and we're going to really be focusing on trace minerals. So I'm going to turn off the camera and get started. So this is how I felt in 1993 when I went out and practiced. And I'm sure many of you feel as well. Parents presenting to your offices or clinics, and some saying there's no child of mine will ever take a medication, and other parents looking for that medication. Our focus in these modules for ADHD is not exhaustive, but a kind of sampling of some of the nutritional interventions. And I don't take sides or don't take camps, but I believe the core foundation of my work is looking at nutritional deficiencies, metabolic abnormalities before looking at medication or pharmacological interventions. So my goal is to help you guys prevent some of the stress 30 years ago about trying to sort out the direction. And We'll start off with lead and copper, these heavy metals, and certainly early in my pediatric training, we all understood how lead affects the brain, particularly ADHD. But Flint, Michigan certainly put it on the front page and kind of woke up both the medical community to the effects of lead. I'll touch upon that, but what happened since Flint is states around the country started looking at their drinking water. This was studies done in 2016 in Massachusetts, in my state. So 30 public schools, and these were the water fountains, and mostly elementary schools, and the vast majority had elevated levels of either copper or lead. So elementary schools, out of the 300, only 73 did not. And the nice thing, and the reason I use this as an example, is copper, I think, is much more common, copper toxicity, and much harder to treat and diagnose than lead. But it was really remarkable. It got front page of the Boston Globe, but really nothing else since then. We have to at least go over the lead comp work. I'm not going to go into that detail because I think it is both pretty clear. Risk of ADHD increasing with blood levels. And here, a recent study in psychiatry research, the highest blood levels over 2.17 micrograms were 155% more likely to be diagnosed with ADHD. A pretty remarkable correlation. They followed over 2,000 kids without ADHD. Again, those with lead developed ADHD within a couple of years. It's a Mexican study. Here, I put in because a very low exposure. So in the old days, when I started off my training, the numbers, the associations of a microgram per deciliter of lead changed. I think when I started it was 10 or less, then it became 5 or less, and here 5 or less positively associated with hyperactive impulsive behavior. I think it's pretty clear from the literature and researches that any amount of lead can affect brain function development with much higher incidence of ADHD. There are literally hundreds of articles. The mechanisms are pretty well known. Lead impairs many aspects of the blood-brain barrier, blocks NMDA receptors, and displaces calcium. Here, Korea study, 256 8 to 10-year-olds, again, higher blood levels, 3 times the risk, inattention and hyperactivity, and more kind of correlations of low concentrations affecting risk. The reason I want to start with it, one, Flint, Michigan certainly put lead as a problem on the map, not to be ignored. Two, other than our early lead screens, I don't even know if it's just under 1 year of age that our pediatricians are routinely testing it. We're not testing lead on our 5, 6, 7, 9, 10-year-old kids. And I think the literature is quite clear. If someone is presenting with ADHD symptoms, lead levels should be automatically looked at. Exposure can come from many different places. And just like iron deficiency, we'll talk about a little later, we have a routine. We test in infants, and then we just forget for 16 years until adolescent female starts menstruating. So lead and ADHD. As I shared with you, the copper testing in the Massachusetts schools, the vast majority had elevated copper. I think the easiest concept is the seesaw for zinc and copper. If zinc is low, copper starts increasing, and vice versa. Copper is common, certainly in our environment. Most common sources are in the copper pipes from our drinking water. We also see copper accumulates with zinc and manganese deficiency, birth control pills, smoking, medications that might have copper. Copper is common in our environment. What happens for very, very high copper is significant toxic effects on the brain. The mechanisms are due to this dopamine copper complex that is an oxidant and the dramatic oxidation of dopamine and subsequent neurotoxicity. What is less clear in the medical literature are these modest increases in copper or copper that gets stored in the tissues and not detected by dramatically elevated toxic blood levels. And that's more of what we're seeing when we're treating with ADHD. We look at hair mineral analysis on every ADHD child that we look at. The copper-zinc ratios have been incredibly accurate. Here you see copper off the charts. It can't even be put on the chart. We also look at blood levels, but not as accurate. Ceruloplasmin is the protein that carries copper, helpful, but not always as accurate. I've been looking at copper-zinc ratios on a trace mineral hair test for 30 years, and it's been very helpful. We'll talk a little more about copper, but I think the symptoms of copper excess are usually those kids that are somewhat aggressive, hyperactive, irritable, and pretty significant dysphoric, irritable moods. We also see kids with this excess high copper having poor response to medication. Copper is important as one of the cofactors in dopamine norepinephrine synthesis. So as copper accumulates, we have a slightly excess dopamine, and if we add a medication, our stimulants that are going to continue to increase dopamine, we're going to get agitation. The other thing we talked about last module was elevated HPA, causing a poor response to stimulant medications and adding high copper. So some of these kids that have dramatically aggressive, very bad reactions to stimulants sometimes could have high copper and elevated HPA. So we'll come back to the copper story, but we'll go to the seesaw. So elevated copper means low zinc, and so much of the research that's been both reputable around the world and replicated is the function of zinc in the central nervous system and zinc in ADHD. Zinc has incredible both structural and functional properties in the brain, very, very high concentrations in the hippocampus. Zinc affects so many aspects of both GI and brain function. We'll get to some of these during tonight's course, but just to go around this little slide, how many kids with ADHD have problems sleeping? Many would refer to ADHD as a sleep deficit disorder, and melatonin requires zinc. So we go from serotonin to melatonin with a zinc enzyme. A GI discomfort, nausea, bloating, all the digestive enzymes, hydrochloric acid are all zinc-dependent enzymes. Vulnerability to stress, decreased taste. Some of our ADHD kids are drawn to junk food, and we ask them about taste. Oftentimes when they're zinc deficient, high copper, they don't taste foods. We talked about essential fatty acids. Zinc is critical for the rate-limiting step for both omega-3 and omega-6 elongation, for puberty, appetite, and we're going to focus on attentional difficulties. The literature on zinc and depression is extensive. So lots of things, and here's just some of the kinds of things we're going to be talking about: zinc deficiency and zinc supplementation and zinc augmentation in medicine. But here, 43 ADHD kids, 30% had severe zinc deficiency versus 0% of the control. We look at zinc, as I shared with you, in the copper-zinc ratio in the hair. We do look at RBC and even serum zinc. It's usually not normal, not accurate, but when we find it low, it is significant. Here you see zinc status inversely correlated with ADHD symptoms. This is serum zinc levels. And here you can see that the inverse correlation between zinc levels and parent-teacher rating scales. Similar study, lowest blood levels of zinc, the most significant ADHD scale. Another study correlation here, they looked at hair zinc, and this was associated with ADHD symptoms, as well as you see up above serum zinc levels. For most of the labs, the normals are somewhere between 70, similar to what's up here, and 150. And I like to see zinc levels between 90 and 100 at a minimum. So again, just a few of the studies, but we have significant studies looking at zinc deficiency, and then a couple studies looking at zinc supplementation. Here, 400 kids, zinc monotherapy, 150 milligrams per day for 12 weeks. Whenever you look at some of the psychiatric studies with nutritional supplements, depending on where in the country, where in the world that these were done, the dosage varies pretty tremendously. The forms of zinc might vary tremendously, and it's just kind of how the literature is, and we'll try to summarize what we've seen. But typically, we would not use 150 milligrams of zinc. We would focus on 15 to 30 milligrams, 60 milligrams for adolescents. This is a study in Turkey, pediatric journal, looking at zinc levels that were normal. So another important point is normal zinc levels, small amount of zinc, 15 milligrams a day for 10 weeks, with improvement in not only ADHD symptoms, but some of the behavioral symptoms of conduct disorder and oppositional defiance. And then from zinc supplementation, we can go to zinc augmentation. These are a couple studies looking at those kids who were taking medications and augmented with zinc sulfate solution for 6 weeks. And those with the lower ADHD ratings at each of the 2-week kind of evaluations increasing over time. So zinc augmentation, 55 milligrams per day. The methylphenidate dose was 1 milligram per kilogram per day compared to placebo for 6 weeks. And here you see these are parent rating, and you see the difference between those with methylphenidate and zinc, which are the dark circles. So the parent rated the kids as better, and these are the 2-week intervals, and at 6 weeks, a very statistically significant difference versus just medication alone. This is by Dr. Arnold, is a well-known child psychiatrist, been looking at nutritional interventions for ADHD for a number of years. He focuses on research and academic papers and been trying to clarify this issue for many years. But here, 30 milligrams a day of zinc glycinate, 52 kids for 5 weeks, and reduce the optimal dose of stimulants by 37%. So we have zinc deficiency in many studies. Again, I just shared a couple. There are many more, and other references are available in the Finally Focused book and on the website. And then we have zinc supplementation, and then we have studies looking at zinc augmentation. Most of the time, zinc deficiency is in relationship to elevated copper level. I shared with you the copper is a cofactor in dopamine and norepinephrine synthesis. Here you see where zinc is cofactor in the amino decarboxylase enzyme as we make dopamine. And then we see that zinc, is critical both presynaptic for serotonin synthesis and in postsynaptic in serotonin response. And then what's kind of more dramatic and probably more significant is zinc regulating this dopamine transporter. So the dopamine transporter, let's see if we didn't mark it here, but that's going to be the receptor in the presynaptic cell that it reuptakes dopamine after it's released in the synapse. So if zinc binds to this transporter and inhibits dopamine uptake, the result is going to be dopamine is going to be around in the synapse longer to enhance the dopaminergic effect of cognition, of attention, of motivation, and supporting that reward pathway. When we think of our medications, all of our medications that we use for ADHD are stimulants, are medications that affect dopamine, both reuptake and synthesis. And here is another mechanism to support dopamine, both synthesis and minimizing reuptake with zinc. So if we summarize our zinc copper issues, it's common. Laboratory testing, I do a serum, sometimes RBC levels of zinc and copper, not always accurate. The trace mineral hair test has been accurate. That zinc copper ratio has been my model of treatment for many years. Supplementation. Most of the time we are looking at copper excess and we are supplementing with zinc alone. It is not mega doses, it's not high supplementation, it's 15 to 30 milligrams for kids, 30 to 60 for adults, for adolescents, 60 to 90 for adults. We try to use zinc with meals or after meals. If you take zinc on an empty stomach, you will get nauseous. Kids will never forgive you. They'll never take it again. You get really nauseous taking zinc on an empty stomach. The dosaging is typically 2-3 times a day are ideal, but twice a day would be the minimum. Again, we're not using copper. Occasionally, we do see copper deficiency. Mostly the symptoms are depression, not attentional problems. Side effects. I shared the nausea side effects with the zinc. The only other side effect I see with zinc is if you take high doses for long periods of time, what's going to happen? You're going to deplete copper. So I've had more adults, but some kids, parents of autistic kids, they put their kids on zinc and they left them on it for years. They were told there was a deficiency or they read about it. And what happens with chronic zinc intake in supplement form, you're going to develop a copper deficiency. Excess copper, the same. If you're taking supplements, we're going to talk a little bit about broad spectrum micronutrient supplements. Oftentimes, there's too much copper, then you can depress zinc. Zinc and copper should be tested for every child with ADHD. Blood tests are not sufficient. Okay, we touched upon this a little bit in the last module, but I want to take a few more minutes. Phosphorus reduces the absorption of many nutrients, magnesium being particular. I believe it is a problem in our diet, and particularly with the food-based additives and the phosphoric acid added to all our processed food, and particularly soda. And here you see increase the total phosphorus content of the Western diet by 60%. Why is that a problem? We talked about this as well. 60 million, because some people believe that phosphorus does affect behavior. This woman, Hertha, is a German pharmacist who was struggling to treat her child and wrote about phosphate behavior problems and very extensive research. It's a very well-researched book, and they talked about some of the studies that they were able to do. Here's her son, and here's just an interesting kid who symptoms of ADHD were under control. They gave him capsules with 75 milligrams of phosphate and significant relapse of symptoms. So low phosphate diet benefiting, giving them phosphate challenge, relapse in many of the ADHD symptoms. Besides phosphorus as a problem in itself, its effect on magnesium, is, I believe, one of the most significant aspects in our kind of ADHD micronutrient story, because phosphorus and magnesium will form these complexes in the GI tract, so we can minimize the absorption of magnesium. This effect is actually greatest when magnesium is low and phosphorus is high. The literature on magnesium and ADHD is extensive. Besides the phosphorus, we've talked in the past, many medications that bind magnesium, alcohol, and probably the most common, besides minimizing dietary intake, would be stress. As cortisol levels go up, magnesium is depleted. Even though many of our kids might be eating chocolate, probably not dark chocolate, and there might not be much chocolate in the chocolate they're eating. So we're talking about green leafy vegetables, beans, whole grains, and nuts, not necessarily part of many of our ADHD kids' diet. Here, study done, public health study, 700 adolescents, highest intake of dietary magnesium, least likely to have symptoms associated with ADHD. This was one of the early studies. It's been quoted a lot. They looked at hair and serum and RBC magnesium, and 95% of those kids with ADHD, 7 to 12 years of age, were shown to be deficient. Again, one of the first studies carefully looking at it and been kind of widely quoted and used. And there's been many, many more studies. This is a meta-analysis, 6 experimental intervention studies on magnesium and ADHD. Conclusion, magnesium is effective for ADHD. Again, just looking at some of these studies in the wide range of dosages, 200 milligrams a day of magnesium for 6 months, 50 hyperactive kids, decreased scores across all ADHD scales. Here, magnesium was added to kind of other micronutrients. We've talked about zinc, omega-3, and as I talked about last time, omega-6 with omega-3s tend to have more positive results in more of the studies. 12 weeks, and here reduced symptoms of ADHD and sleep issues as well as emotional. This was just a case study, but it was written when they were 7, but the history is pretty common that we see hyperactivity, sleep disturbance, anxiety, aggression, and then magnesium and B6 with normal sleep patterns, normal aggression, and better ability to pay attention. And I like this study, one, because as you kind of look through some of the research, and a big part of the article that we published in the Journal of Orthomolecular Medicine was an international global perspective, because so much of the research that we're seeing that's been written in the past 10 years are coming from around the world. This study was in Russia. I never heard of time in Russia, but B6 and magnesium, magnesium lactate, about 145 milligrams, 15 milligrams of B6, low dosages, but improvement in many areas of ADHD and anxiety. And then an Egyptian study, 200 milligrams, pretty dramatic results, decreased, you can see, hyperactivity and attention, better executive function, and better oppositional. So let's try to kind of summarize lots of different magnesium supplements. If we went through the last 10 studies, there'd be different magnesium preparations, citrate, glycinate, gluconate. There were some studies on magnesium threonate with absorption across the blood-brain barrier. I've not seen a good one just on ADHD. I have not found the form really that significant, except for I don't use oxide. I've seen some individuals respond better to one chelate than another. I've seen loose stools and side effects on one versus another. Oftentimes, as some of these studies I did mention, utilizing B6 does enhance absorption of magnesium across the cell membrane. So our clinical summary, magnesium is probably the most common nutritional deficiency that we see in ADHD. I would say I have no problem recommending magnesium supplementations for individuals presenting with ADHD, regardless of any testing. That's one of the few nutrients. The dosages really vary depending on age and size, but I'd say for an adolescent, total of 400 milligrams per day, usually divided at least twice a day, depending on the preparations. You don't have to be exact, but we try to get around 400, even up to 600, but it's divided 2 or 3 times a day. The common clinical symptoms of magnesium deficiency that we see in our ADHD kids are constipation, irritability, anxiety, insomnia. If your kids or the adults with ADHD have 1 or 2 or 3, often 4 of these symptoms, it's likely magnesium will be a problem. It can take time, and I'm recommending 3 to 6 months of magnesium supplements. Sometimes parents are going to notice improvement in sleep quickly in a couple weeks, but like so many of the nutritional interventions, parents are anxious for the quick solution and get disappointed if the kid is not perfectly cured. I got a call recently after 1 week, a frustrated parent. I put them on it was magnesium and lithium while we were waiting for the testing, and they were upset because the symptoms were not completely resolved. Pretty much the RBC magnesium is helpful, but not always reliable. Blood tests are not helpful. The 99% of all the magnesium is in our bones, in our cells, not in our blood. So blood tests are just not going to be accurate. I do also look at the hair test as a measure of the calcium magnesium ratios, and I've done thousands and thousands of them. And again, the vast majority, I'd say 98% of my ADHD kids or adults would have low magnesium levels on trace mineral hair tests. I think I discussed most of this. Supplementation side effects is, as expected, loose stools. It's the only side effect, or sometimes occasionally GI cramping. Sometimes it's dose related. Parents, again, reading a story and trying too hard, or clinicians putting kids on too high a dose. Oftentimes, it's not dose related. I've had kids or parents who've noticed diarrhea symptoms on 120 milligrams of magnesium glycinate. Uncommon, but we see it. Again, often changing the form of magnesium, lower dosages can prevent that only side effect, which is loose stools. Okay, zinc, magnesium, iron. I mean, to me, iron falls in that same category as lead. It is so obvious, and the research is quite clear that iron deficiency is associated with ADHD, but our pediatricians aren't routinely testing for iron or ferritin levels in our adolescents, unless they're females and might be menstruating heavily, and it's certainly not being routinely tested in our boys. A young child comes in lethargic, they might test for iron. A lot of the research looking at ferritin levels, some at iron levels, but you see here a serum ferritin was low in almost 92% of the ADHD kids, 0% of the controls. Ferritin low in 92% of the ADHD kids. This was an interesting study where the lower ferritin, higher doses of amphetamine to achieve optimal response. The kind of research that has been around for a long time, I'd say the past 10 years, newer research has supported the association of low iron, low ferritin with ADHD symptoms. Iron is critical for, again, dopamine synthesis, and simple blood test, and we would treat it like we would for any other iron deficiency, anemia, with iron supplements. So I want to just take a minute to talk about lithium. It is one of my favorite trace elements. I think When we talk about ADHD, we can talk about it as a attention deficit disorder. Some people think about it as a sleep deficit disorder, a light deficit disorder. I believe that my work has shown me that's more likely a micronutrient deficit disorder, and lithium is certainly kind of a neglected nutrient by traditional standards. I love the term primordial nucleosynthesis. So about 13, I don't know, I think it was 13.8 billion years ago, the Big Bang. There were only 3 elements in our environment, hydrogen, helium, and guess what? Lithium has been around in the formation of the Earth for 13.8 billion years. This nutrient, I believe, is essential for brain function. We see it associated with many psychiatric disorders, from ADHD to Alzheimer's. For our purposes today, we're going to have a webinar, separate webinar on lithium we'll talk about, but we're all familiar with pharmacological dosages, and there is research looking at aggressive ADHD conduct disorder kids responding to lithium. And we also know lithium is toxic. It is actually life-threatening if it's taken in toxic dosages, so we don't use it. What we really don't understand is what's this maintenance level, and my interest is, what is a deficiency in lithium? Is there a deficiency of lithium? I believe there is. I believe a deficiency in lithium is based on the amount of lithium in your water supply, in your soil, as well as genetic needs. So those individuals with a higher kind of genetic loading for major psychiatric illness, substance abuse, bipolar disorder, have higher needs for lithium. And so is there a maintenance dose? I believe absolutely. What is that dose? It varies from individual to individual. Lithium deficiency affects major psychiatric diagnoses. Our ADHD kids are the ones you think of getting kicked out of preschool, irritable, aggressive, and with labile moods. So if we put together that a subset of kids that literally are kicked out of preschools that they're being, families are paying for. So you can imagine a school asking your child to leave, even though they're losing that income. They must be pretty significant. So the 3 kind of high impact interventions for that aggressive behavior disorder kid would be high copper, elevated HPA, gut dysbiosis, or lithium deficiency. Oftentimes it's those 3, and treatment can be really dramatic. So ADHD nutritional deficiencies, the research is clear. Supplementation we've discussed. I try to share with parents that you don't start everything at the same time. You start off with 1 at a time. Magnesium is always the best place to start, and then based on individual testing, treat in a personalized, methodical, careful way. So, I wanted to end our kind of micronutrient discussion with some of what we call broad-based micronutrient formulas. And these are formulas, this was supposed to be throwing the kitchen sink in. So these are broad spectrum nutrients that have vitamins and minerals and amino acids, and there's a couple on the market. A lot of the research has been done by Bonnie Kaplan and Julia Ruckledge, and we're going to go through some of those studies. But the theory is somewhat counter to the work that I've shared with you, is looking at these objective tests and treat accordingly. And this argument would be, well, just provide very high doses of all these vitamins and minerals to supersaturate all the enzymes required for neurotransmitter synthesis and see if we get improvement. And the studies are pretty significant, and I'll share some of the pros and cons. I'm not going to go through all these studies, but I thought this was interesting because Julia Ruckledge did this. It was an earthquake that occurred in the middle of her study, and this was a study on broad-based nutritional supplements with ADHD. So what they were able to find as they looked at their cases, that those individuals taking the micronutrient formula had less stress, 6 times less stress and anxiety, and 2 times less depression 2 weeks post this earthquake. Interesting study, but again, in the middle of our ADHD study, significant earthquake, 7.1 magnitude, and they thought these micronutrients were protective of stress, anxiety, and depression. And then there are some ADHD studies. Many of the studies with these broad spectrum micronutrient preparations are mood disorders. Some are ADHD and mood disorders. This one had ADHD. You see here, it's 15 capsules, 3 doses, 5 capsules taken with food. When these formulas first came out, I would say 20, 25 years ago, patients were asked to take 32 capsules per day. Early studies at McLean showed some positive results. I could never get my 8-year-old child to take 32 capsules per day. Over the years, they cut the dosages to 15 capsules. And again, here's studies, again, from the same group in New Zealand, improvement in ADHD scores, but also in mood scores. Published in the British Journal of Psychiatry, 80 adults with ADHD, micronutrient formula, and placebo, 8 weeks, improvement rated scales. Here, again, CGI, their clinician global improvement. It's just a scale of 4 or 5 numbers. So they're either not improved, improved, very improved, greatly improved. So it's a very simple scale. It's used in research studies because it's easy. You just circle one thing. It doesn't really provide an accurate representation of some of the specific improvements that we're looking for. Again, follow up here, same study, 48% improved versus 21% in the placebo. Again, high placebo response in both measures here. These then were followed up after a year, so outcomes remained significantly improved. One of the things that we find in a lot of the micronutrient studies, from omega-3s to zinc, and here this broad spectrum micronutrients, is once we replete and the nutritional deficiencies are treated, oftentimes there's sustained improvement for long periods of time. And here's a last score. Those who stayed on these micronutrients had the best outcomes, scores falling in the normal range. So we can do testing, magnesium, zinc, watching out for elevated copper and lead, or these broad spectrum micronutrient formulas that oftentimes can be helpful. My concern with these micronutrient formulas would be a particular elevation in copper. Last time I looked at some of these formulas, if you put the 15 pills together, they're getting much higher than a normal requirement for copper. Now, for some of these kids, they have low copper, and the elevated copper can be very helpful. But for a lot of kids, and that's why I stopped using these routinely, that they have high copper, we're introducing 15 pills a day that have some copper. The total is too much copper. And as I started seeing side effects to these broad spectrum micronutrient formulas, I was able to determine over time that it was due to the copper and that we were kind of overdosing them on copper. So for me, if you're going to use this, try to assess copper levels before. When I end our course, kind of beyond micronutrients, what else? Exercise. You're probably not going to get a better medicine for ADHD. Many parents are aware of it, and the research community has caught up with the parents, as we normally do, years behind. But we have over 40 studies looking at the positive benefits of cognition, attention, brain function, many theories. The most consistent finding that I read is elevations of BDNF, brain-derived neurotrophic factor, related to exercise. It is not always have to be strenuous physical exercise. Some of the kids who you really don't expect to be able to sit in not sit or stand perhaps in a martial arts course, that they do incredibly well. So martial arts has, over the years, been one of the most helpful exercise routines. I have kids that have done yoga, kids that have done aerobic exercises. It really varies. I want to talk about parents' perception. This was a study done a couple of years ago. Significant percentage of the parents were able to articulate this positive impact with symptoms. You have much to learn, my son. You can't say on with his head after you said off with his head. So I kind of want to take us on a summary now of the big picture of ADHD and why we're doing what we're doing with integrative and orthomolecular medicine. You can't say on with his head after you said off with his head. Our children, our adults with ADHD are painfully aware of some of their deficits, of some of their disabilities, if you will, about focused, sustained attention or inhibiting their impulses. They are looking and asking for help. The consequence we talked a little bit about, we have emotional impairments, behavioral impairments, with dramatic effects in work, divorce, relationships, financial problems. A new study came out on increased smoking in ADHD, substance abuse, and we'll keep coming back to self-esteem, that early insults to self-esteem are lifelong baggages that affect every aspect of one's life. So untreated ADHD is what we know has devastating effects. Treating ADHD does not necessarily mean amphetamines or medication. And this was a study that got a lot of press. Everyone loved the names. I think the million hits, over a million on Psychology Today, why French kids don't have ADHD. And they compared the incidence of ADHD in America, 11% minimum of 4 to 17-year-olds, at least 6% taking medication. And they picked a study of less than 5% of kids in France. And it was just a powerful message that people kept reading and liking and sending around. It turns out it wasn't really an accurate representation. As people looked into the stats, that research has demonstrated that in France it's actually 3.5 to 5.6 a diagnosis of ADHD, which is around the global averages, 5 to 7, higher in the United States. But there was something very powerful about this editorial or this blog, I think it was written as a blog, that ADHD is just this made up United States disorder because we have too many TVs and we don't have enough discipline. So we loved the concept that French kids don't have ADHD, but it's not true. And our model of this genetically driven neurobiological disorder certainly kind of makes sense of this global 5 to 7% of school-age kids with ADHD. And besides the emotional behavioral impairments, I hope that's about all of them. I'm beginning to lose interest. Getting bored is often that early common denominator that we can pick early. We can find out from teachers and just asking our children how they're doing, and they'll tell us. And listening is probably my number one parenting tip after 30 years of listening to parents. My sense is they don't listen to their ADHD kids. They focus on their behaviors and don't listen because as parents, what do we know best, right? We know where you should study, how you should study, what you should eat, what you shouldn't eat. So listening is number one, and then stop being so critical is my number two parenting advice. It is really dramatic what happens in my office, and I'm sure you see it as well, where parents are just so frustrated with this list of ADHD behaviors that they're correcting them all the time, they're criticizing all the time, and even though you might apologize after you do it, it is that constant bombardment. And this was just, really, I think a dramatic study, over 300 kids, 388 kids, and the families that express high levels of criticism. Sometimes we see it from just one parent, just the mom or just the dad. It is split. Oftentimes, The poor kids that have two parents that are constantly criticizing them for not remembering their homework or getting the assignments right or forgetting their hat at school. The list goes on and on. But the punchline here, that the overcritical parents, those kids did not experience the usual decline in symptoms with ADHD. In the old days, we used to talk about ADHD as a neurodevelopmental disorder with a lag, about 1 to 3 year developmental lag. So there was some maturity and some catch up. And this study was just an elegant way of articulating that a high critical parental relationship, these kids did not get better. Behavioral training is talked about, but really, and it's well researched, but it's not always recommended. I think partly our parents are looking for the quick fix, partly our pediatricians don't have the time, and there's only a subset of parents that are looking for therapy or bringing their kids to an outpatient therapist for parental behavioral. So, our guidelines have shifted. The American Academy of Pediatrics, they have thrown in behavioral therapy before medication, certainly for our younger kids, 4 to 5. But guess what? They also now have approved the use of medication for children as low as 4. So for our younger kids, we're thinking food allergies, casomorphins, leodorphin, HPA, and copper. And here, for our children and teens, 6 to 17, American Academy of Pediatrics are recommending behavioral therapy and medications, and we're looking at the totality of our plus-minus plan, trying to understand those things that we need to add to the environment, add to the child, meaning the magnesium, zinc, essential fatty acids, and those kinds of things we need to remove. The heavy metals, the dysbiosis, the yeast, and the criticism. So besides the overcritical parent, beyond biochemistry, again, sometimes the behaviors are so frustrating that the anger and resentment just builds up over time. I've had parents sit in my office and tell a child how they ruined the entire ski trip for the entire family. And not only did the kid feel bad about behaviors on the ski trip, but to hear it again, to be humiliated in front of the doctor, it just goes on and on. So part of my message is helping families kind of let go of that anger and resentment. Some of that is taking care of self-care for parents, and then positive feedback versus this punishment. I've had parents, more so early on in my career, who just removed, as a punishment, would start taking things out of their room. And I had parents come in to see me and presented their story where there was just a mattress on the floor of the child's room. They kept taking everything out as this kind of punishment, trying to get better behavior. Our typical punishment mode of behavioral management is not going to work with our ADHD children. Positive feedback is powerful. Immediate, direct consequences for behavior is powerful. But I think the most overwhelmingly therapeutic intervention is what we've talked about, is look for the biochemical underlying contributing factors, focus on listening and not being critical. And here, probably the most important thing I can share with you, discover and support the activities your child enjoys. It really varies what environments our children with ADHD can succeed in. It's never predictable. You would think the typical ADHD kid is high stimulation, needs to be, skydiving, stockbrokers, always busy. But I have kids whose attention can be sustained by sitting at the bank of a river and fishing. Other individuals who can't sit still at classroom, can't get through homework, but can sit hours doing chess because it stimulates their brain. Our goal is to discover and support what activities our kids like, and more importantly, to foster those activities and to kind of minimize the struggles that they might have in other environments. So the findingfocusbook.com website, there's an incredible amount of research articles. They're somewhat buried in the news section, but when I was looking at that for over a year, there's hundreds of research articles looking at nutritional deficiencies in ADHD. And then my website also has links to research on other major psychiatric illnesses. So again, thank you for your time. Have a good night and thanks again.